Good morning to you, welcome. It's Talkin really on a Monday. This is obviously Bank Holiday Monday, and you may or may not have heard, because it's not very obvious, it was announced by a guy called Chris on Twitter, who has discovered that there is yet another medical procedure approved by the UK government, and it's called Skycovion. It's a COVID vaccine. So whatever you think about vaccines, whatever you think about COVID is irrelevant. What is important is that this has been approved yet again by the UK government with little or no testing. You are going to be, if you take this, you will be the test, just in the same way as before. We'll have a quick look at that, and then we'll go over to the government website. Here's Chris making the various points. So, number one, efficacy. Efficacy was not part of the clinical trials. That means that they don't know if it's effective. They didn't test to see if it's any good. Number two, if it does provide protection, they don't know what it will be because it's in clinical trials. Yet again, another product. If they give it to you, you'll be the lab rat. Number three, if they don't know how it affects pregnant women, no trials have been conducted on that. Medical staff should consider the risk-benefit before doing it. Number four, they have no idea how it affects babies through breastfeeding, because obviously they haven't done any testing. Number five, you definitely won't get any protection until you've had at least 2 shots and waited 14 days. But even then, they don't know what protection you'll get after that date. Number six, between 1 in 100 and 1 in 1,000 people reported a cardiac disorder as an adverse drug reaction. Number seven, he just cannot believe that this has been approved. Obviously they're using the population to test it. There is no systematic safety studies, and they're dishing out to anybody. So that is the tweet. Quite damning, really. Now, obviously, people want to see the actual data, the actual information from the government. Let's have a look. Here we are, gov.uk. Regulatory approval of COVID-19 vaccines, Skycovion. So this has been approved by the MHRA for use in people, England, Scotland and Wales. You want to have a look at this information, patient information leaflet, which they've obviously got. There's loads of information. It allegedly there's not any animal products in it, and of course a full list of ingredients can be found on the summary of product characteristics. So we have to have a look at that, which is this document up here, summary of product characteristics. So if you want to have a look at this, you can go and have a look. I'll put the link down below. There is no data available with interactions with other medical procedures that you may have had. Individuals who have a first dose should receive a second. There's no information, elderly and of course there's no information on pediatric, that's children. Contraindications, it's a very small list. Special warnings, yeah, so they're all, so it's very standard. No protection is anticipated after the first dose, and individuals may not be fully protected until 14 days. So they will not be vaccinated fully until after the second dose. Exactly what we said earlier. There's no experience in pregnant women. Breastfeeding, there's no correlation there either. Animal studies, which they allege that they've done, no effects there. And then of course they're giving adverse reactions from the clinical trials. So they really knocked this one out. I don't know how long they've had it in the pipeline, but you can see here it is already out there. So they're saying that this is they've got sodium chloride, tromethamine, trauma, whatever that is, arginine, sucrose, and water in the actual thing. Sodium chloride, hydrogen phosphate, dihydrogen phosphate, potassium chloride, and basically vaccine must not be mixed with other products. It's got to be stored in a fridge. There we go. So this is SK Chemicals. Don't know who they are. Date of first authorization, the 26th of May, and this year. So only 3 days ago this was approved. Of course, you will not be surprised at all, because I wasn't. It's been supported by funding from the Bill and Melinda Gates Foundation and Coalition for Epidemic Preparedness Innovations, that's CEPI, C-E-P-I. It's South Korean, apparently, and they only used 3,787 shots by November 2022 out of 10 million that they ordered. There's an article that was there, you can see, I'll put it on the screen. Basically, this is SK Chemicals. It's been authorised by the MHRA with obviously no testing whatsoever. They have no idea if it works or if it's safe, because they haven't done any testing. And this is approved by the UK government, MHRA. It's all there. It's all facts. This is not conspiracy. It's actually there in black and white. And you can see yet another of these products being released for you to test. Anyway, I'll come back to that story later on as another story I want to do. In the meantime, have a good day and keep safe.